Welcome to this educational video about Leigh's disease, a rare and devastating neurological disorder. In the next few minutes, we'll explore what Leigh's disease is, what causes it, how it affects the body, and what the current approaches are to diagnosis, treatment, and research. This information is intended for educational purposes and should not be considered medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment. Leigh's disease, also known as subacute necrotizing encephalomyelopathy, isn't caused by a single factor, but rather a collection of genetic defects that disrupt energy production in the mitochondria. These tiny powerhouses within our cells are essential for converting food into energy that our bodies can use. Most cases of Leigh's disease are caused by mutations in genes that code for proteins involved in the mitochondrial respiratory chain. These mutations can be inherited through autosomal recessive inheritance, meaning both parents must carry the faulty gene. Less commonly, Leigh's disease can be X-linked, meaning the mutated gene is on the X chromosome, or caused by mutations in mitochondrial DNA and mtDNA, which is inherited only from the mother. It's worth noting that identifying the specific genetic cause can be complex, as many different genes can be involved. The underlying problem in Leigh's disease is a deficiency in the production of adenosine triphosphate, or ATP, the cell's primary energy currency. This deficiency primarily affects the brain, particularly the basal ganglia, brainstem, and cerebellum, regions vital for movement, coordination, and breathing. Without sufficient ATP, these brain regions experience cellular dysfunction and ultimately cell death. This leads to the characteristic lesions seen on brain imaging. The exact mechanism of cell damage involves a combination of energy depletion, increased levels of lactic acid in the brain tissue with lactic acidosis, and the accumulation of toxic metabolic byproducts. It's a cascade of events triggered by the impaired mitochondrial function, resulting in progressive neurological decline. Leigh's disease is a rare disorder. Its exact prevalence is difficult to determine, but estimates suggest it affects approximately 1 in 40,000 newborns. Because it's a genetic disorder, it can occur in any population worldwide. The disease typically manifests in infancy or early childhood, although later onset forms have been described. It affects males and females equally when the cause is autosomal recessive. When the cause is X-linked, males are more severely affected as they only have one X chromosome. The symptoms of Leigh's disease are highly variable and depend on the areas of the brain most affected. Common early signs include loss of developmental milestones, such as rolling over or sitting up, feeding difficulties, and persistent vomiting. As the disease progresses, other symptoms may emerge, including muscle weakness, movement disorders like dystonia or ataxia, seizures, vision problems, and breathing difficulties. Some individuals may also experience lactic acidosis, which can cause rapid breathing and fatigue. Because Leigh's disease affects so many systems, the range of symptoms can be quite broad, and diagnosis can be challenging. Diagnosing Leigh's disease requires a combination of clinical evaluation, neuroimaging, and laboratory testing. A neurologist will carefully assess the patient's symptoms and perform a neurological examination. Magnetic resonance imaging's MRI of the brain is crucial to identify the characteristic lesions in the basal ganglia, brainstem, and cerebellum. Blood and cerebrospinal fluid (CSF) samples are analyzed for elevated levels of lactate and other metabolic markers. Genetic testing plays a vital role in confirming the diagnosis and identifying the specific gene mutation involved. Muscle biopsy may also be performed to assess mitochondrial function directly. While Leigh's disease doesn't have distinct types in the traditional sense, it's often classified based on the underlying genetic cause. Identifying the specific gene mutation is crucial for genetic counseling and understanding the inheritance pattern. Some cases are caused by mutations in nuclear DNA, inherited from both parents, while others are due to mutations in mitochondrial DNA, inherited only from the mother. Furthermore, the age of onset can vary, with infantile onset being the most common, but also later onset presentations. Currently, there is no cure for Leigh's disease. Treatment focuses on managing the symptoms and providing supportive care. This may include dietary modifications, such as a ketogenic diet, to improve energy production. Vitamin supplements like thiamine, riboflavin, and coenzyme Q10 are sometimes used to support mitochondrial function. Medications may be prescribed to control seizures, manage muscle spasms, and address other specific symptoms. Respiratory support, such as mechanical ventilation, may be necessary for individuals with breathing difficulties. Physical and occupational therapy can help maintain muscle strength and mobility. Palliative care is essential to provide comfort and improve quality of life. Because Leigh's disease is caused by genetic mutations, there is no way to prevent the disease itself. However, genetic counseling is crucial for families who have a child with Leigh's disease or a family history of the disorder. Genetic testing can determine if parents are carriers of the mutated genes. If both parents are carriers, there is a 25% chance with each pregnancy that their child will inherit the disease. Prenatal testing, such as chorionic villus sampling or amniocentesis, can be used to diagnose Leigh's disease in a developing fetus. The prognosis for individuals with Leigh's disease is generally poor. The disease is progressive, and there is no cure. The rate of progression varies, but most affected children survive only a few years after diagnosis. Recent research is focused on developing new therapies that can improve mitochondrial function and slow disease progression. Gene therapy holds promise as a potential future treatment, but is still in the early stages of development. Clinical trials are ongoing to evaluate the safety and efficacy of various therapies, and researchers are working to better understand the complex mechanisms underlying this devastating disease. We hope this information has been helpful. Thank you for watching.